good day and good afternoon to those in Phnom Penh, Cambodia, in Jakarta, and elsewhere in Indonesia, and good afternoon to those joining in Australia. So this morning we have a special session of Forum Kajian Pembangunan in collaboration with colleagues in Cambodia, the Cambodia Development Resource Institute, or CDRI, and the Asian Vision Institute. Before we start the presentation, let me remind everyone that you can join later in the Q&A session by writing your comments or questions in the Q&A box. For those joining on YouTube, you too have a chance to participate. You can write your comments or question in the comment box in YouTube, and we will transfer it to the Zoom room. If we have time, hopefully we do have time, we will post the question to the speakers. So this morning we are joined by I'm sorry if I pronounce it incorrectly, but Mr. Vichea Vanna Phuong from the Cambodia Development Resource Institute, who will be chairing our discussion today. So I let Vichea to introduce the speakers and the discussants and chair the rest of the seminar. The Zoom room is yours.
Thank you. Yep, thank you. So again, good morning and afternoon, ladies and gentlemen. My name is Vichea, Vanna Vichea, a research associate from the Center of Policy Research in Agriculture and Rural Development of Cambodia Development Resource Institute. Basically, I'm really delighted that I have chance to be as a chair and as a moderator for today's discussion on COVID-19 food security and cash transfer in Cambodia. And at the same time, I would like to begin by thanking all of you for joining us today. I would say this is a vital topic, and I'm confident that the insight shared from our main presenter will be valuable for our collected efforts to address food security challenges in Phnom Penh City. So again, I would say we are so fortunate to have a distinguished speaker and two honorable discussants with us today. Mr. Ari Perdana, a PhD candidate from Maastricht University, will be presenting his preliminary finding, and Mr. Sokcheng, the director from the Center for Policy Research in Agriculture and Rural Development, accompanied by Dr. Kimlong, whose work in Asia Vision Institute Cambodia, will be our main panelists. So for today's agenda, we will be having a 30-minute presentation presented by Mr. Ari, followed by a 10-minute each discussion for our panelists. And the audience also have chance to ask the presenter as well. So before we jump into our main discussion today, I would like to brief some significant points related to our topics today. As you all know, and it's stated clear in our topic, the COVID-19 pandemic has a significant impact on all aspects in our life, and Phnom Penh as well has not been spared. Hence, the webinar here aims to explore the linkage between the COVID-19 food security and the effectiveness for cash transfer program in mitigating the pandemic impact on our city residents. That which is denoted for some main point that we need to consider, like economic disruption, supply chains challenges, increased food prices, and vulnerable groups as well. And at the same time, as also stated in the topic, I would say during the pandemic, understanding the situation is evolving and impacting people's life is very critical. So the way that conducting the traditional data method, like face-to-face survey, and that would be slow and impractical to some challenges and restriction. So using a high frequency phone survey would become a game changer. So this is a briefly talk about the overall concept of our webinar. So without a delay, I would like to introduce our main speaker, Mr. Ari Perdana, to present his preliminary finding. So please welcome Mr. Ari Perdana.
Okay.
So I will
Thank
inform
you.
you. Yep. Sorry.
Okay, no, you want to say something?
Yep. You could share your screen and I will
Okay.
inform you the remaining time you have. Yep. Thank you.
Okay, thank you very much once again, Mr. Chair, fellow discussants, and thank you very much for FKP organizer for this opportunity to share the ongoing work of was taken from my dissertation at Maastricht University entitled COVID-19 Food Security and Cash Transfers, Evidence from a High-Frequency Phone Survey in Cambodia. So I will start with a usual introduction, followed by a brief overview of COVID-19 in Cambodia and how the government responded. Then I will briefly explain the data and some descriptive results, followed by my empirical approach and some preliminary results. I will emphasize the word preliminary here, and finish with some summary and plans for next steps. So as we know, COVID-19, as Mr. Chair mentioned, COVID-19 affected our lives in many different ways. It's a health crisis, but at the same time, because of the measures to curb the virus, the spread of the virus, it's also created another problem, which is socioeconomic problems. And one of the socioeconomic problems around the world is food security. It was an unpredictable event affecting food security at the global level. Poor households in the poor countries, especially those from the marginal communities, like minority ethnics, are more vulnerable to food security. And to ease the burden of the socioeconomic impact of the pandemic, many governments around the world, including Cambodia, introduced varied measures in terms of social protection and jobs. In Cambodia, of course, the topic of our discussion is the cash transfers program. So in a way, it's an interesting time for a program evaluation these days. This leads to my research question: how effective was the Cambodian cash transfer program for poor households in mitigating food insecurity during COVID-19? Through this work, I would hope to contribute to the empirical literature on the impact of the global pandemic on food security, the role of cash transfers in maintaining food security, as well as the application of the use of large-scale household panel survey conducted during the pandemic. So this paper is informed by four strands of literature. The first is, of course, the literature on food security, and then the impact of COVID-19 on food security. Another strand of literature is there is a large body of evidence on the effectiveness of cash transfer programs on several outcomes. And lastly, it's also informed by the existing studies on the role of cash transfer programs on food security during COVID-19, which is right now the evidence is quite thin. The evidence is scant with some mixed results. There are some papers found a positive contribution of positive contribution on cash transfer on food security, while some other papers did not find positive or significant contributions. And this is where I hope that this work will contribute to the existing body of literature in this topic. So yeah, Cambodia, I think most of our participants now know more about Cambodia than me, but in terms of food security, before the pandemic, Cambodia, based on the Global Hunger Index and Global Food Security Index, Cambodia was considered as having moderate food insecurity. Then a statistic collected by the Food and Agriculture Organization found that in 2019, 47% of population was either moderately or severely food insecure. So it's not food, so it's moderate, but there's some evidence that food insecurity may have increased during the pandemic. So COVID-19 in Cambodia. So like many other countries in the neighboring Mekong region, Cambodia went through 2020 with relatively few number of cases. So the explosion of cases happened later in 2021, as you can see in the yellow part of the graph. However, the government has introduced some economic restrictions as a measure to curb the spread of the pandemic as early as March 2020. As you can see from the stringency index, and the stringency was maintained throughout 2020 and increased later in 2021. It led to a GDP contraction by 3% in 2020, relatively mild compared to many other countries. However, sectors that contributed to most of the GDP and employment, tourism, garment, footwear, construction, were the most affected. To ease the burden of the population, the Government of Cambodia introduced a cash transfer, a COVID-19 relief cash transfer program, or CTP, around June 2020. The beneficiaries initially targeted 560,000 households, later to be increased to more than 700,000 households. The targeting mechanism, it follows the proxy means testing initially using the National Database of Poverty Targeting, ID-POOR. So beneficiary households were given this card as part of the identification process that they are part of the National Poverty Database. But later, the government, at least on paper, introduced the so-called on-demand registration. Poor households, if they feel that they are eligible, can nominate themselves to the commune council, and then to be verified and interviewed later. And if they have met the criteria, they will be included in the revised database. It's an unconditional cash transfer, but the benefit value depends on the household characteristics. There is a structure design for the benefit, but on average, the households receive equivalent to $45 per month, which, if I get my statistics correctly, it's about 20% of the minimum wage in Cambodia, or around 50% of the average agriculture income in the rural area. Coverage, according to the Government Official Statistics, in July 2020, it reached 94% of the targeted population, the intended population, which is people in the ID-POOR database, and later increased to around 97% in May 2021. So data. So for this paper, I use the data from the high-frequency phone survey collected by the National Institute of Statistics and the World Bank, supported by the World Bank during 2020 until 2021. It's publicly available data, and for Cambodia, unlike the other countries that the high-frequency phone survey were conducted, it has two surveys, two models. One is the general population based on the LSMS, around 600 households per round. And there is a specific model for ID-POOR households, around 1,000 households per round. So the sampling frame are different. One is from national census, and the other is for only within the ID-POOR households. For this paper, I will use the second model, the ID-POOR survey, which means I focus on the poor population. It means that I can eliminate some of the heterogeneous effects. So this is the number of sample for each round. It's a panel round. I will explain about the panel nature of the survey later. the phone survey during pandemic has been useful tools to to collect real-time information about the socioeconomic situation during the pandemic. But from the survey perspective, of course, we need to acknowledge they have many limitations. So enumerator will have to deal with bad signal or call drops. But the main limitation of this survey for this paper is that phone survey have to be conducted in limited time, meaning that there's a lot of information that could not be collected. For example, the survey did not ask the respondents about what is your income last month, or what was your expenditure last month, and some of the information could not be verified directly from the observation by the enumerators. But yeah, despite the limitation, it still has useful tools to conduct some socioeconomic analysis. So here are some basic descriptive statistics from the survey. This is the characteristics of the households. So N is 6,000. It's a pooled data across the 6 rounds. What is interesting is, correct me if I'm wrong, Mr. Chair and fellow discussants. So I think in Cambodia, ethnic Khmer is around 96% of the population. But for this survey, the sample of the survey, ethnic Khmer only consists of 77% of the population, and urban sample, urban respondents only consists of less than 10%, despite we know in Cambodia, 24% of the population live in urban areas. So maybe that shows something about the characteristics of the poor households in Cambodia. Most households reported their income dropped in June and August. Then they said that the income remained steady afterwards. So June and August, the first half of 2020 was the period where most households reported income decline. So how did households cope with the income decline? Most of them answered that they cope by reducing food and non-food consumption. And they also did some versions of financial management, borrowing from relatives, excuse me, credited purchase or delaying bills payment. But later, government assistance, was one of the significant coping strategies later on. So for this analysis, my dependent variable is food security. So I use the concept, I use the measurement of based on the food insecurity experience scale, FIAS, which is a yes/no answer to 8 questions, and each question represents different degrees of food insecurity experience. The mildest form is whether the household is worried that they would not have enough food to eat. And the most extreme situation is whether the household went without eating for the whole day. Based on these questions, I constructed what is called as the raw score of food insecurity experience, basically just summing up all the yes responses without taking into account the different degree of food insecurity. So based on the raw score, we can see that in round 2, these questions were not asked in round 1. So we only had the information starting August 2020, round 2. You can see that there is a high portion of households answering yes to 4 up to 8 questions, meaning most of them are in the moderate or even severe situation of food insecurity. But later on, household usually said yes to 0 to until 3 questions, meaning most of them are in the mild or even food secure. The other measure is the rush score. It's based on the item response theory. I will not elaborate it much more here, but basically rush score, we take into account that different questions will lead to different severity of food insecurity. The good thing is that both ROS score and rush score, they are consistent. Different scale, but you can see that the trend is quite consistent. Higher score in August, but lower score and steady afterwards. The independent variable is some variable related to the receive of cash transfers program. As you can see that the number of household received COVID-19 cash since June is an accumulated. It's starting with 82% in August and increased to almost 100% in April 2022. So it's basically almost universal across ID poor households. However, the expansion of this cash transfer program is gradual or phasing in. So for every household, you can see that there's always some household receive the cash transfer for the first time, only one time. And there is a variations of the number of COVID-19 relief cash in every rounds. Similarly to the total value of the cash received since June, the accumulated total value, although the average in October is 730,000 real, but some household will only receive for the first time, meaning they receive 120,000 real, but some household receive more. So with this variation across household in each round, that will lead to my empirical approach. So basically, I will try to exploit the fact that the COVID-19 cash transfer is gradually expanded. So empirical approach. So this is the stylized theory of change for the empirical approach. It's depicting how, the relationship or the impact from COVID-19 to receiving cash transfer to food insecurity. However, we also need to be aware that for each step, there are some events or variable that can be the potential moderators that may lead to smaller or even no effects on food insecurity in the end. First, I would like to see the determinants of receiving cash transfers. So I ran two probit regressions of the probability of receiving cash transfers. So Z is 1 or 0. So either the household receive cash transfer or not, against a set of household characteristics. Then I will also use two continuous variable, which is the frequency of cash transfer and the accumulated cash receive against the same set of household characteristics. So here are the results. Apologize, it may be too small for you, but basically the first result that we see is there is no regional differences in the probability of receiving a cash transfer program. And then households with kids or with younger kids are more likely to receive cash transfers programs. Household whose head was unemployed during the last week also slightly more likely to receive the cash transfer. And household who was not a beneficiary of other cash transfer like a CCT, the existing CCT, are less likely to receive cash transfer. So I don't have the explanation right now. Need to explore it more. But at the same time, household who receive food or in-kind transfer from other sources like NGO or relatives were also more likely to receive cash transfers. Then I'll move to determinants of food insecurity. Here I started with a linear regression. The dependent variable is a Vichea row and rush score against a set of household characteristics, and Z is the variable of receiving cash transfers that we discussed earlier. So some results, so we can see that the coefficients are negative for the 4 dependent variables, meaning that receiving cash transfer or receiving more cash was associated with lower food insecurity or greater food security. However, the results are not statistically significant. So I'm not showing the full regression here, but basically I also found that households are less food secure if they have more kids, if they have unemployed head of households, if they experience income loss compared to the last survey round, or if they receive food or in-kind transfers. And it's consistent between the raw score and the rush score. No statistical differences between male and female headed household and across regions. So there's, of course, on the linear regression, there is always potential endogeneity, which I will remedy. I will try to solve using the fixed effects regression. So for the fixed effects regression, I use the panel nature of the data. However, there are some limitations. One is the question on COVID-19 cash transfer only started in round 3. And after round 2, the sampling frame was reset. I have not received the explanation why, but basically I can only construct the panel starting round 3, which is a pity because then I missed the opportunity to check the impact of. I missed the period where food insecurity exploded in the first 2 rounds. But yeah, so this is what I could do. Some household drop off samples as usual, but when I check, there is no systematic pattern on the probability of being re-interviewed. So the fixed effects regression, I found similar findings with the OLS. Coefficients are negative except in model 2, where I use receiving cash in the last survey. But the results are not statistically significant. If the household head was employed and whether household experienced income decline compared to the last survey were more important determinants of food insecurity, it turned out. And we also found similar finding for the fixed effects regression using the rush score. Okay, so what does it mean? To summarize, and this is very preliminary conclusion, of course. So I found that the cash transfer had a good coverage, and it could have helped poor households in Cambodia coping with income shocks. However, empirical analysis showed that there was no effects on cash transfer on food security. That could be some possible explanation. One possible explanation is the cash transfer value was inadequate. However, it contradicts the earlier findings that household considered cash transfer as one of the important way to cope with income shocks. Second possible explanation is food insecurity situation in Cambodia, especially after August, perhaps was not as bad. Households have other means to secure their food access, which the survey was not able to capture. Another possible explanation is that the cash transfer impact reached a saturation point where an extra real did not really have the impact on food insecurity. But I think the bottom line is that cash transfer program provided a safety net for households, but may not be a safety rope, meaning that they may have helped households in maintaining food security situation, but at the same time did not improve it either. So by that note, I will end my presentation, and hopefully I could generate some response and inputs on whether the paper get the story or narrative correct. whether the research question and design is appropriate, or should I consider other approaches, and what are other possible explanation for lack of significant findings. Thank you very much.
Thank you, Ari, for your insightful presentation on your preliminary finding. So right now, I would like to bring our main discussion to our main panelists, Mr. Chheng and Dr. Kimlong. So if you have any comments or something you want to add, please, I give the floor to you. Thank you.
Thank you, Vichea. I will start first. Since the agenda is like that, so I would like to share my screen as well. I hadn't put my comment in the PowerPoint, but I try to comment on the slide like that. Do you see my screen sharing?
Yes, I can see that.
So I would start with congratulations for your research, and it will be very useful for governments or for others, that especially on the emergency like COVID situation happen again, what kind of method, cash transfer or something else that are useful to cope with the food security. So starting from my comment, I will follow one by one slide and finish with the overall comment. So I think the research question is okay. We want to see the effect of the cash transfers for food security during COVID. So this also we talk about during COVID season, and you have literature. I put some comment on the literature. So food security is not only you assess and eat it today, but also the stability. So I put it here like changing over time. So whether you receive food security and when you get the money from government these 2 days or this month, later on, you still continue getting, or your food security still continue secure or not. So this also think you should also take a look on the time change. Cash transfer, you put literature. I think you should focus only on the COVID time, because cash transfer literature is various. So like, for example, school enrollment, that's not related to COVID at all, and also the nutrition. So during the COVID, cash transfer mostly to provide food for the household that's no food available. So maybe should focus only on the COVID-19 time cash transfer. And for the effect of the COVID-19 on food security, I think these I think that three impact is more on the global, but we are here talking about household food security, so maybe focus on the degrees of income. I think the degrees of income is one of the main factor food security, as we see also in the migration. And I'm not sure whether you do literature like 2 or 3 years before, but right now I think there's a lot of literature about COVID on food security. Maybe you can do more research on that to fill up, because last night I tried to Google and I saw a lot of research on that food security, and there's also one research in Cambodia with similar, using the same data from World Bank. I will show the letters. Second page for the fact sheet. I'm sorry that my note was erased. I don't know why it was erased from this page, but I think you should put like the year is like poverty is 2012. That could yeah, you have to align the year different. same year. And COVID situation, I think you put here, it's quite good, like lockdown period. But what I suggest that you do small situation analysis together with the timing of the cash transfers. So you put when is cash transfer, when is the lockdown, when is the round of the interview in one timeline. It's easy to see what the changing when you do the interview round one, for example, in August, and the question on the income, for example, it was asked like a few months before that. So it should more analysis on this timing and the situation would provide more idea what is the change, what is the problem. It should be easy to interpret later on. And another one, I maybe question, I'm not sure whether you can answer, maybe your audience can answer as well. Why the on-demand registration? There's no on-demand registration. That also maybe everybody is beside the ID pool is also already have food, or I'm not sure, but maybe should put it. Data, I think when I look at your presentation PowerPoint, it's quite challenging to understand because you put very limited information about the data. Maybe if you have the report to share with us, that should be easy to understand. So I try to Google and look at the World Bank data to try to understand. So you use only the data of ID, the poor people, poor family. And this is very important for the result. I will explain that later on. And the household characteristic, yeah, you are right that like urban, it's not there because maybe the survey only focus on the rural area. Maybe you should just take away the urban population sample from that. And I had a question on the N number of total sample is 6,400. Is it the whole rounds, 7 round sample? Yeah.
Yeah, but pooled sample.
Yeah. And income, I think you also should mention in the report or in the presentation whether this previous period, when is the previous period, like I mentioned before, when is the period that was asked during the interview, like for example in June, I think when I look at the questionnaire, it's asking since March, and the round two asked in August and recall back from June, so it's around like 2 or 3 months period. So maybe it should have more clear about that so that we can interpret the data easily. Coping strategy, as we can see that saving is very small, so because there's not many, they are poor households, so saving is very small. So when there's no income, that's why in your regression, when the decrease of incomes, the food insecurity increase because there's no saving. And if there's no other transfer like from government or from in-kind, they will face with the food insecurity. So saving is very important for in this case. I suggest that you add this coping strategy into regressions to balance with maybe control on the incomes side, because you don't have the variable on the household income, right? And the food score, I'm not sure what is a RAT score, but it's okay because it same the same result. And I saw one other paper that I mentioned that they only use the modest and serious score. So if you look at this score, like 3 means that it's very mild insecure, right? So it's more like that's not really a issue here. So if you look at all the data, like from round 3, mostly it's three score. So these most likely you don't find insecure in the house in the sample. So my suggestion should be like you only use like the moderate or severe. I will show you the paper that I mentioned. Uh, so here is the paper that I cannot get out of the. Okay, do you see my screen again? Yeah, this is the paper. I'm not sure who did it. Soro, and they use a cross country around the world, but they also use Cambodia as one, and they found the effect of the the case transfer. So you don't find the effect, but they find the effect. So I'm not sure what is wrong with you, but I will explain more on that. So they use only a few question, like question the like for example skip meal. So see that the change from wave 2 to wave 4, something like that. There's slightly decrease of that. Also, like without eating a whole day, there's a decrease of that. So if you put all the score together, the food insecurity is very low because it's 3 points. So maybe you just focus on the top one, on the insecure. I will go back to your slide again. And the number is very challenge for me before you present. So I try to look at the data as well. So this is the number of the COVID that received and the amount that they received. But I try to do it in using the data. I'm not sure, can I share my PowerPoint again? I share let me finish it and share the yeah, this one. See, I'm not sure how you get when I try to see this round.
Sorry, I think Chheng has an internet problem, connection problem.
I think so.
30% something.
Oh, okay.
Bong, please your mic. Please turn it on.
Okay, sorry. I'm not sure when did I disconnect, but I will try to share my data again. So just to show that when I try to tap under cash transfer, that almost like 90 something percent of each round they receive cash transfer. So the number is very similar across rounds. I'm not sure what is your numbers. I will share back the PowerPoint. So you don't present the serial change. So that's what also I don't want. I might comment that. Okay. So the result of the determinants, I'm not sure. Since like maybe I try to explain in this OS the whole regression. So the data is all poor family, and all of them receive cash transfer. Like most of them receive cash transfer, and the score of the food security is very similar, like around 3 from the round 3. So I feel that this model is like have like, because they are not correlate. If we say it's not correlate, so you cannot find the significant by using the score and the cash transfer. You know what I mean? So that's why in your model you cannot find the significance of the cash transfer into this, because you, the I think there's no correlation between the score and the cash transfer, because the whole population is poor and most of them receive the cash transfer and the score is same. So that is why the result is not significant. That's what I think the flaw of this equation. So maybe my suggestion, try to separate by like the serial one, like I mentioned in the papers, but you need to make sure what is your contribute, what is the difference between that study that already done and what is the contribute of your study. And also you mentioned the amount that received, because I saw that there's an increase of the amount of received by rounds, but is it like different very far between only a few households that are not receive that large amount? Maybe you should check also that. That's why the regression is not significant as well. And yeah, maybe because of the score that we use is for food insecurity is not that bad insecurity that you put in here. I think so. Just to wrap up, so maybe put more on the try to so your regression, your analysis more like whole general. Maybe you can separate by rounds, or try to see the timing of each intervention of cash transfer, the number of cash transfer, and the amount each round, and also look at the income decrease, because income decrease in each household contribute a lot to the food insecurity. And maybe try to do more literature on what have been done for Cambodia in this topic, so that you have more idea to cap and what is your unique of the paper. Thank you.
Thank you, Mr.
Thank you.
Sokcheng. Yeah, for your fruitful comments. I think it's a bit over time, but it's a good points that he has raised so far. So not to waste our time more, I would like to invite Dr. Kimlong to give your comment on his paper. So the floor is yours.
Well, thank you so much. Do you see my slide, my screen? You hear from me?
Yes.
Yes, we can
Okay.
see the slides are okay. Yeah.
Okay, yes. Okay, first of all, I have to thank Professor Budi Resosudamo, my supervisor at the ANU. who invite me to discuss the paper of Ari and also my colleague. I think, for the paper just presented by Ari, it provides a lot of potential with regard to some empirical evidence on the impact of cash transfer in Cambodia. And I concur with my friend, my colleagues, Sokcheng, who just discussed the paper a moment ago on key empirical approach and also the data. I will go straight to the point with regard to the question you ask. It is very relevant. I think many government officials in Cambodia have also asked me to work on some publication and analysis with regard to how the cash transfer program in Cambodia has helped particularly to reduce or to alleviate the severity of food insecurity in Cambodia. We do not have much data on this one, despite the fact that there are some studies. You can find some literature. I concur with Sokcheng a moment ago. I think maybe you look into some of the other recent publications on this one. There have been publications.
Sorry, doctor. Sorry. Would you mind if I interrupt a bit? Would you mind show the full screen? Put it full screen. Share it. Yeah.
Is it?
It's
Not
better
yet?
to see. Not yet.
Why can't I cannot. Yes, sorry.
Yeah. Thank you.
Yeah. COVID-19 phenomenon is a global shock affecting health security, food security. It is a fundamental aspect of human security. And the Cambodian government is one of the governments in the world that intervene to help people cope with the shock. The strength of your paper, I think I revert back. It's very relevant for the topic, and also the primary data you have collected, despite the fact that the data you do for the empirical analysis is only from round 3. There are some good points and some not. I think this is the compromise we have when we do the short preliminary phone survey like that. Like the independent variable, of course, you cannot go down to more objective, quantitative statistics. It's quite hard. You have to spend many years or many months and a lot of money to do that. So it's subjective, depend on the household, is depend on the interviewer. Sometimes, they have different perception on the extent to which food insecurity they face, like a number of meal per day. I will go in further detail. The empirical approach, I concur, and I do agree with Sokcheng and also with Ari. You present a very good empirical approach. You test the determinants of food insecurity. You also test the fixed effects to control, the region, because there could be some different impacts across the regions in Cambodia. I give you one example. During the COVID time, it is a phenomenon that households receive food from their family members in rural area. Unlike in the pre-COVID time, people send money back, people send food. But during that time, because they have family members in the rural community, some of them also receive some other in-kind food support, not by the government, but by relative. Then I come to a conclusion on the empirical approach. I think maybe quite still limited because you have not put a number of controls in that. So I will go through from here to look on your theory of change first, on your conclusion, and I give some suggestion. For this one, for your theory of change, I think you appear to skip some control because, you know, COVID shock, of course, it is a global shock. It affects everyone. But in terms of now, it comes to higher risk of food insecurity. And then there is still, I think you explain another, the maybe cycle of relationships between the risk of food insecurity, cash transfers, and other domestic and cross-border phenomena. Because during that time, food prices also rises across the board. At the same time, there were food shortage. Food shortage because of what? Because not of the external shock or the climate change shock, but because of the transport, cross-border transport restriction by many countries. And then the food availability itself has been affected. The food availability in Cambodia. This is what I suggest. Maybe you look into the food price shock as well as a proxy for food access. Is one, and the second is the food availability as a proxy for food supply, the supply shock due to cross-border transport delays. Because I think in your model, I don't see that. Maybe in your paper, the whole paper, complete paper, you include all of those. But in the model that you just presented, I think we do not see any other controls, important controls. Maybe you did not cover it in your phone survey. And then back to point number one, it's whether you test or you check the result between households that receive cash transfers versus those who did not receive. Because sometimes there could be no difference at all, because the amount of cash given to the poor household was quite small, $50, quite small. And then at the same time, the food price shock, the supply shock, the demand is there, but the supply shock and the food price shock, because the food price shock and the food availability shocks are already the two indicators or two pillars of food insecurity. Maybe if you have data, I think it's better to take into account all of this. You know, in your result, I come to the conclusion of your result. No statistical between male and female headed household. It's an important indicator. However, maybe this is I mean, during the pandemic, I think maybe it's quite hard to look into gender aspects because everyone was facing, you know, food shortage, and but it's also very good as well, you know, to explain some possibility that, you know, sometimes food distribution within the one household remain affected by gender. Maybe housewives are better at managing, distributing food to the household members. Your primary conclusions with regard to no effects of cash transfer on food insecurity. I think maybe because data sets itself, you did the phone interview, and independent variable is subjective, and the round of panel data you included maybe can be further expanded. I suggest you look into the data set of the government cash transfer program that would be available, and then They may not have the data on food consumption during that time, but at least you have the 700,000 household that receive the cash transfers in the later round. And then I think maybe if time is available for you and also some funding available, you can expand another phone surveys looking into the existing household, and also I think look into those government statistics as well. I like your conclusion on the last part. The cash transfer program provided a safety net, but not safety rope. Help household maintaining security, but they do not improve it for a long period of time because it is only a very short, intervention. It's a short intervention. To sum up, your data is quite good because you use the primary data. And I suggest at the same time to look into the government data set and add a few controls. Lastly, also important that you may test some transmission channels. Sometimes it's not because of the cash transfer itself, but some other channel, for example. Thank you.
Thank you.
Thank you.
Dr.
Thank you
Kimlong.
very much.
Yeah, for your comment. So, Ari, do you have any ideas on what our panelists comment so far?
Thank you. Yeah, I received many valuable comments about methodology, about the narrative. I don't think for the interest of time, I can go through them one by one, but the idea of looking more into the data on what other possible controls, for example, the coping strategy used by the households, or possible, possible variables that could be a proxy for food access. Yes, I will look more into the data, and then suggestion also from Daniel in the chat room about employing staggered difference and difference. I think Dr. Kimlong also mentioned that. Yes, that's also something that I was considering. And then, of course, the suggestion on including some more existing literature survey and what else I have. Yeah, I wrote down most of the comments, although now I cannot read my own handwriting by myself, but that's my problem. But as a bottom line, I really thank you for your very valuable suggestions, and I hope that I can integrate them in the next version of the report and also the presentation. And just a clarification, this is I didn't collect the data. I used the data collected by the National Institute of Statistics and the World Bank, which is publicly available.
Thank you, Ari, for your response. So right now, I would like to ask our audience if there are some questions they want to ask our presenter. So if you have questions, you can raise your hand, yeah, and ask. So I think one of our panelists raise the hand. Budi, do you have any?
Yes, thank you very much. Ari, thank you very much for the presentation. So for number one, I think you will have a big issue in arguing that you got a causality over here. So for example, it seemed to me that you have two options. So the other people and you trying to do like staggering, but you need to show parallel trend, and your observation is actually after the lockdown. Now you could so in the case of Cambodia, please, I think in your graph you show that the timing of the lockdown and the first case are different. And if you would like to argue that the effect is after the first case, meaning that lockdown will be effective after the first case, then you got a survey that it's before the first case and after the first case, and you're trying to check whether there is a parallel trend before that. But one thing that another technique that you would like to consider, I thought that if you just look if you just look on your sample those who are poor and you have a household income, yeah, among the poor, I just wonder, so then you decided, for example, this is the average of household income among the poor, and you do an RDD. Wait a minute, there is no so the cash trend. Okay, so let me come back. So I just wonder whether you could implement an RDD based on the cutoff of government policy on receiving a cash transfer. So for example, the policy said that if your income is $300 per month, you receive, and you have data on your household income that surrounding those, you got some number, and then you use RDD away from that cutoff. So that is the second option that you might want to implement. But yeah, I mean, so far, I don't think we haven't seen yet the effect of cash transfer on food security based on the current result. Thank you.
Thank you. I think we have another person, Daniel. He's also raised question. Ari, you said in the chat box, so would you mind responding?
Yes, Daniel suggested the ID and then the mistargeting as an instrument, which now it's quite appealing. Daniel, I have no response to that yet, but I will have a look on that. And also to Mas Budi, no, the RDD was, I was considering doing RDD. The thing is that the government targeting mechanism was not, well, it's based on proxy means targeting, meaning we need the information on like household assets and some other variables, which may or may, I don't think it's available in the survey. But there may be some further analysis I could do, which is some differential effects comparing people on the poor and the very poor. I think we have some information about that, which I will consider. There are some things that I cannot do based on the limitation of the data.
Thank
Maybe
you. So
we should allow Daniel to talk.
Yes, I think we should allow Daniel to talk.
I don't have anything to add. just giving some suggestions on the identification strategy. Yeah, thank you.
yeah. So right now we have another question from Asi Haloman, if I'm not wrong. Yeah. So he's raising that maybe I missed the information, but our representative is a phone survey in Cambodia. Is ownership of a telephone common? I think you like to respond that.
Yes. So based on the report, accompanying report by the World Bank for the survey, the phone ownership is, even among the poor household, is quite high relatively. Not 100%, of course, but it's quite high. I forget the number too, but sorry about that. But the sample frame, it's designed so that it reflects the population of the ID poor households, ID poor database, which is around 600 something households, poor households in Cambodia. Yes, of course, the thing with phone survey is, especially among poor households, phone numbers changes every month because they don't have the money to extend the balance. they don't have just simply they don't have balance to make calls or to receive calls. Yeah, those are limitation on phone survey that is widely acknowledged.
Thank you. So are there any other questions that
I,
our audience want to ask? Okay.
Vichea, I would like to add on the phone surveys data. So according to World Bank websites, the response rate is only 51%. So they suggest that you use wage to avoid issue with the data. So I'm not sure if you use wage or not, but this is the suggestion from World Bank. Yep.
Oh yes, I use the weight variable that provided in the survey.
Okay.
Thank you, Mr. Chheng. So are there any other questions? We would love to hear from you. Okay, I believe there might be no more questions, I suppose. So again, thank our presenter and our panelists for the informative discussion on our COVID-19 food security
Sorry,
and test sector.
there is one hand.
Oh, one hand, just earlier. Yep. Sorry about that. Mr. Dr. Alfredo panelist, would you mind give him access to raise his question? Alfredo? Yep.
I think Alfredo is still muted.
Yeah, he needs to turn on his video. He's been allowed to turn on. Sorry, to turn on the mic.
Oh yeah, he's on right now.
Right. Can you hear me now?
Sure.
Okay.
Would you mind turning on your camera?
Is it not on?
Sorry,
Yeah.
it's not possible to turn on camera, just the mic.
Okay.
All right. Oh, okay. All right. I'm just would like to comment on the statistical method used, mainly on, I would say, just regression with regards to food insecurity. I was just thinking that maybe more independent variables are needed, so we can see more or less the impact of these determinants to food security, such as not just income, but probably other determinants like employment and disability. Probably it will give a better understanding on the relationship of this food insecurity rather than simply the cash transfer system. It's just a thought. Thank you.
Thank you. Yes, I tried to do different sets of independent variables until I came up with this some set that I believe quite representative and also possible. I did put employment of the household head or the main bread maker in the family as one of the control variables. Disability, I didn't add, but I could add because I think there was a question about whether the household has a disabled member. Then I can add just to see if has any impact. But yes, some of the independent variables are may not be too relevant for the models. But thanks for the suggestion.
Okay, thank you. I think we have another one. They raised about how effective the CPT in terms of space. So if you have any idea, Ari, on that particular question.
I didn't quite understand the question, so maybe can
Yeah,
we invite the participant to speak?
yeah. Muhammad. Yeah. I think he could turn on his mic, right? Muhammad, are you there? We give access to you to turn on the mic to speak. Hello, Muhammad. Simon. I
Or
think he's not on right now.
okay, yeah. Although if I get it correctly, like how effective is a cash transfer program in different settings, like in archipelago? I believe there has already been some studies looking at the impact of cash transfer in different types of geographical situation. I don't have the answer on the top of my head, but I think that could be a suggestion that I will also include this kind of discussion in the literature survey. Although for Cambodia, I think it's not an archipelagic country, although there's some geographical differences within the country. There is a plateau, mountainous, coastal area, which I included as the control variables in regression.
Okay, thank you for the phone. I hope it's answered Muhammad's question. So, are there any other questions? I think it's almost time as well. So, if you have, you could raise it right now. Okay, I suppose there will be no more questions. So, like I said, it's almost time to conclude all the things that we have done so far on our discussion. So again, I would like to say thank you for all our distinguished presenter, Mr. Ari, and our main panelists in that having an information discussion on COVID-19 food security and cash transfer program in that impact in Phnom Penh City. So we have heard a lot about the methodology and the finding and so on and so forth. And especially we get the fruitful comment from our panelists to help Mr. Ari to get a better and to polish his finding as well. So it's a good opportunity if the upcoming finding could give us more insights. Yep. So again, like I said, it's a brief one. I think I should conclude all right now. And if you have any questions, I think you can approach directly to Ari if you have more comment. And again, thanks everyone for joining the event. And I suppose I would say it's time to say goodbye, right? But we can catch up later on.
Yes, thank you very much for all the comments and the homeworks that you gave to me this morning. I will take into account. And thanks, Vichea, for chairing the discussion. Thanks,
Oh, thank
FKP
you very much.
organizers.
It's my pleasure too.
Okay. Thank you, everyone. Thank you to the panelists, Sokcheng and Kimlong. We're talking about COVID-19, and probably this is one of the silver lining of the pandemic, because nowadays we can have a discussion on COVID research online, on any research online across continents, across countries. So the research could hopefully be better informed because of the input from everyone. So before I close, thank again, and please follow FKP social media or website to see about our next programs. Thanks everyone, and for those fasting, I hope that your fasting is going well until the end, until Idul Fitri. Bye.
Yeah, but thank
Inshallah.
you.
Bye.
Yeah. See you later.
So I'll close the Zoom. Bye everyone.